Namaskar and welcome to Midday Prime. Updates from India and the world on COVID and other stories. The RBI Governor Shaktikanta Das announced a 50,000 crore rupee priority lending by banks for hospitals, oxygen suppliers, vaccine importers, COVID drugs by March 31st, 2022. Now, news also from the world of business and sports. This is Midday Prime. Let's begin with the big news at this hour. Indian Air Force and Indian Navy work on a war footing to ferry oxygen. DRDO is setting up 5 oxygen plants in Delhi and Haryana. AIIMS and RML hospitals get oxygen plants. New plants to be operational from today. GPS and vehicle location tracking devices mandatory for oxygen containers. Threefold jump in production of remdesivir. The Union Cabinet approves additional food grain allocation to NFSA beneficiaries under the Pradhan Mantri Garib Kalyan Anna Yojana for another period of 2 months to counter the poor's economic hardships due to COVID-imposed disruptions. RBI announces measures, new COVID loan books for banks, special long-term repo operation for small banks, 50,000 crore rupee stimulus to boost COVID-related healthcare infrastructure. External Affairs Minister S. Jaishankar says that COVID-19 is a global challenge and requires global partnership. Lord's global support for India also says taking aid is not a shift in the country's policy. India continues to receive international assistance to fight COVID-19 pandemic. Supplies arrive from the US, Singapore and Australia. 81,000 vials of remdesivir from the US arrive in Mumbai. Ventilators, 43 oxygen concentrators from Australia reach India. 3,650 oxygen cylinders to reach from Singapore via INS Airavat. Prime Minister Narendra Modi appreciates healthcare workers and nurses of Kerala over the reducing vaccine wastage there. And he says that reducing vaccine wastage is important in strengthening the fight against COVID-19. Mamata Banerjee takes oath as the West Bengal Chief Minister for a 3rd consecutive term at the Raj Bhavan. Prime Minister Narendra Modi congratulates the West Bengal Chief Minister. BJP National President J.P. Nadda administers pledge to West Bengal BJP MLAs against injustice and violence. West Bengal Governor expresses grave concern over post-poll violence. So let's begin with the big story. The Indian Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states across the country. An oxygen express with filled oxygen tankers reached Delhi from Mundra in Gujarat by moving swiftly through a green corridor. And this will ensure the smooth supply of oxygen for COVID-19 patients in India, while one more oxygen express has started its life-saving journey from Hapa to Delhi to provide oxygen for COVID-19 patients in our capital city. Meanwhile, another oxygen express with filled oxygen tankers reached Faridabad from Tata Nagar in Jharkhand. And this will ensure the smooth supply of oxygen for COVID-19 patients in the state of Haryana. The Indian Railways has deployed 19 isolation coaches with a capacity of more than 300 beds in Ahmedabad. The coaches have medical professionals and are equipped with all essential facilities and medical equipment for enabling speedy recovery of COVID-19 patients. India registered more than 3 lakh COVID-19 recoveries in the last 24 hours as per the Health Ministry's data. India reports 3,82,315 new COVID-19 cases in the These were reported, and also 338,439 discharges were reported in the last 24 hours. And during this period, 3,780 people had died. The deaths were recorded in the last 24 hours. And with this now, the total number of infections has reached 2,665,148, and the total number of recoveries cumulatively has reached 1,69,51,731. There are 34,87,229 active cases in the country as of now. The total vaccination coverage has reached 16,494,188. So India has become the fastest country to exceed 16 crore cumulative vaccinations as the nationwide vaccination drive expands. More than 6.7 lakh beneficiaries in the age group of 18 to 44 have been vaccinated under phase 3 of the vaccination drive. On a steady streak, more than 3.38 lakh recoveries in the last 24 hours. So the government of India has so far provided more than 17.02 crore vaccine doses to the states and union territories free of cost. More than 94.47 lakh doses are still available with the states and union territories to be administered, and over 36 lakh doses in addition will be received by the states and union territories in a short time. In a significant development, 2 medical oxygen plants funded by PM CARES these have been installed at the All India Institute of Medical Sciences, New Delhi, and RML Hospital. They have been installed within a week, and they carried out on a war footing. These 2 plants were swiftly airlifted from Coimbatore and installed yesterday. Both the plants will start supply of oxygen by this evening. In order to effectively address the high surge of COVID-19 cases in the country, the PM CARES, it's a fund, has allocated funds for the installation of 500 medical oxygen plants across the country. These plants are planned to be set up within 3 months. In all, 5 high-flow medical oxygen plants will be installed at AIIMS Trauma Center, Dr. Ram Manohar Loya Hospital, Safdarjung Hospital, Lady Hardinge Medical College, and AIIMS Jhajjar, Haryana. Now, the first of 500 oxygen plants that are being set up by DRDO across the country will become operational from tomorrow. This is a medical oxygen plant at AIIMS, and these are being set up under the PM CARES Fund by technology designed and developed by DRDO. Reporter Nandita Dagar spoke to the DRDO spokesperson at the medical oxygen plant set up today at AIIMS.
Oxygen generation technology for our indigenous aircraft, that is fighter aircraft, LCA Tejas. Based upon the same technology, we have developed this medical oxygen plant. This oxygen plant is already functional in some of the military hospitals in Northeast and in Jammu Kashmir, Ladakh area. So we have been given a target to set up 500 such plants all over India in different states, and the funding for this has been done through the PM CARE Fund. On the direction of the Prime Minister, we are setting, this is the first plant which has been set up in Delhi at the AIIMS Trauma Center. Similar plant has been set up in RML today itself, and we expect that both will get started from tomorrow onward. Another 3 more plants which we are expecting next 2-3 days is in Safdarjung Hospital, Lady Hardinge Hospital, and AIIMS Jhajjar.
And our correspondents are joining us. Shishi Shadar is joining us from Mumbai, and Tapas Bhattacharya from Delhi. Thanks very much for being with us. We'll start with you, Shishir. So the situation in Mumbai, it's improving. But what about the oxygen supply situation? What's the demand-supply equation over there right now?
Well, absolutely. Mark, first of all, talking about the numbers here, yesterday Maharashtra Health Minister stated that in Maharashtra nearly 15 districts have shown quite a good results here. The numbers have reduced here. And if you look at yesterday's number, it was around 51,000 numbers, whereas if you see the recovered patient number, it's almost gone to 65,000. And that's the reason the recovery rate of the state is quite well. It's at 85.41%, which is actually quite higher in the country so far in the second wave here. But at the same time, the state is registering the maximum numbers, and that's why, as I'm talking to you, nearly 50,000 cases have been already registered yesterday. The government is now focusing on providing better medical facilities here, especially, as you rightly said, the oxygen supply. The state requires nearly 1,500 metric tons of oxygen supply every day here, and that's the reason various agencies, including the central government, along with the many private entities, have come forward to help the state government. At the same time, the state have issued the global tender in which they have asked for the medical equipments, the oxygen equipments from other countries also. And there are a few countries, the companies from different countries are interested for this global tender. That's what the state government said. The government will also going to buy 18 lakh doses of remdesivir at the same time, the vaccinations also. So obviously, as far as the medical infrastructure is concerned in the state, though the numbers are actually reducing, at the same time the government is focusing on giving a sustainable and probably the overall work of the infrastructure sector. And that's the reason yesterday the Maharashtra Health Minister said that nearly 9 plants have already been operational out of 10 plans which have been supported by this by the center, and which the Prime Minister have already allotted the fund from the PM Care funds. So obviously, these are different things that government is doing, working at this point in time and try to reduce this number. As far as the vaccination drive is concerned, Mark, let me tell you that the vaccination drive was halted at few locations here, but again, as the central government allotted fresh doses of almost 10 lakh, now the vaccination process started at various locations in Mumbai and across Maharashtra.
Indeed, I'll come back to you about the vaccinations once again, Shishir, but let's go across to Tapas now. Tapas, so the situation in Delhi was improving, but the cases have gone up again a little bit as of yesterday. But, I mean, when we look at the demand for oxygen, it had been targeted at about 950 metric tons per day in Delhi. I mean, we are still short of that, but then many of the major hospitals have their own plants set up, and things are definitely in place now, at least for the foreseeable future.
Mark, let me just start with the fact that if you take a close look at the Delhi's health bulletin over the last couple of days, one would realize that the number of cases have kind of stabilized, kind of plateaued, and the number of facilities also even though it is quite high, it's still plateauing as far as the even the government of India. Yesterday also, when there was a health ministry meeting, also they also spoke about the fact that 5 top states which were having the highest load cases, the cases seems to be plateauing. And just to put forward the point that I'm talking about, yesterday's health bulletin that came out very late. In fact, today early morning we received the health bulletin, and according to that, 19,953 new cases came 24 hours, and 338 fatalities. The positivity rate finally is under 30%. In fact, it is 26.73% in that sense. So, in many ways, the situation is looking a little better than what it was a couple of weeks back, considering the fact that the oxygen paucity that was also there, that has also been taken care of. In fact, the Oxygen Express that been run by Indian Railways has so far in the last 24 hours has delivered more than 450 metric tons of liquid oxygen, liquid medical oxygen. In fact, today in the morning, 2 wagons, in fact, we've been told that one Hapa to Delhi, almost 5 tankers came out with a capacity of just over 103 metric liquid oxygen. And then from Mundra port to Delhi, Tughlakabad, another 7 tankers came with a capacity of 140 metric tons of liquid medical oxygen.
Okay.
So combining a total of almost 240, just over 240 metric tons. And if we take a look at the last couple of days, that adds up to almost 450 metric tons of liquid oxygen purely for national capital.
Okay.
And if we take a look at the other aids coming in from to Delhi airport, we've been told that almost 3 flights came from 2 from US and 1 from Kuwait, getting almost almost 500 of oxygen concentrators and 300 oxygen cylinders. So in that sense, international agencies as well as India's
Right, Tapas, we are losing contact with you because your signal is breaking. Let me just go back. Let me go back to Shishir for a moment, and then we'll come back to you. Shishir, you were talking about the vaccinations now. Obviously, this is a very important aspect, not only for the second wave, but also to prevent a potential third wave, because, you know, I mean, this vaccination will keep people safe, and that would prevent a potential third wave. How streamlined is it? And, you know, as far as the 18 to 44 age group are concerned, because that is now the segment that is being targeted, how much enthusiasm are we seeing from the people there?
Well, absolutely, Mark. As far as the vaccination is concerned, let me tell you that Maharashtra so far has received the maximum number of doses compared to other states, because of the numbers obviously we have seen here. At the same time, the state government is also saying that they're ready to increase the capacity here, because every day we are seeing almost 4 to 5 lakh doses have been administered here, and the state government said that they have the capacity to administer 8 lakh doses per day. But obviously for that they need a more vaccine supply. In this regard, the state government have already contacted some of the vaccine manufacturer, be it Covishield or Covaxin. And what we also got to know is that the state will get almost 18 lakh of doses from these companies, out of which 13 lakh they're going to get from Covishield, and remaining they'll get from the Covaxin. Because as I told you just before now, that the state government have floated a tender also, a global tender, in which they've asked for the medical equipment from the different international companies here, and many companies shown their interest. At the same time, the state government is also focusing on buying the vaccination, and that's the reason the 18 lakh doses the state government will procure very soon, and they're already in touch with these two companies here. Well, as far as the number of vaccination doses are concerned, as far as the third phase of vaccination is concerned, almost 18 to 45 lakh, the state government have already started this third phase in Maharashtra, and few lakh of doses have already been given to the people from the age group of 18 to 44 now. As far as the second phase vaccination is concerned, in which 45 plus people will going to get a vaccine, the state government have also made arrangements for those people and for these special second doses as well.
Absolutely.
Well, now, Mark, let me tell you that the vaccination has not just confined to the vaccination center, but in Mumbai we have seen here that a unique kind of vaccination center the BMC have started, that is a drive-in vaccination center. So especially those who are Divyang, the blind or probably elderly, who cannot walk up to the vaccination center, they can easily reach to the vaccination center in the car. The BMC have already arranged the car service for them also, and by sitting in the car they'll get the vaccines also. So these kind of things the government is also focusing on, the local government is focusing on.
Right, that's all the time we have for. Thanks very much both Tapas as well as Shishir for joining us. We're moving on then to our next story. Prime Minister Narendra Modi has praised the healthcare workers and nurses for setting an example in reducing wastage, vaccine wastage that is. Quoting a tweet from the Chief Minister of Kerala, Pinarayi Vijayan, the Prime Minister tweeted, "Good to see our healthcare workers and nurses set an example in reducing vaccine wastage. Reducing vaccine wastage is important in strengthening the fight against COVID-19. Prime Minister acknowledging the role played by the healthcare workers of Kerala. The External Affairs Minister, S. Jaishankar, said that a global pandemic requires global efforts. The EAM said that his message going into G7 is that COVID is a global challenge and a global pandemic requires global effort. He also said that India has contributed to that global effort in the past. The External Affairs Minister is visiting London from the 3rd to the 6th of May 2021 to participate in the G7 Foreign Ministers meeting, at which India has been invited as a guest country.
G7 had its own agenda, this G7, and there are 4 of us who are guests, ourselves, Australia, South Korea, and South Africa. The agenda already had COVID very much in it, because it is today the biggest challenge, but not just India, the entire world faces. Now, when it comes to the G7 foreign ministers, bear in mind, I am pretty much continuously in touch with all of them. Now, they actually have been through it, many of them. My message going into G7 is, look, this is a global challenge. Everybody knows that. All of you have been through it. We are going through it right now. There are various factors and reasons why it's as serious and severe as it is. And global problems, a global pandemic requires a global effort.
Well, while taking part in the Global Dialogue series in London, the External Affairs Minister, Dr. S. Jaishankar, said that Covishield is basically Oxford AstraZeneca vaccine, which is a British-designed product. And he said that it was made in India as a vaccine owner, as the vaccine owner saw India as an efficient production venue.
That ability to make in India, the approvals to make in India, came an obligation to supply it to a large part of the world. Okay, so so the first thing people have to understand, it was not that the vaccine production started in India. It was invented by an Indian, owned by an Indian, produced by an Indian. It was a truly international collaboration. And when there is an international collaboration, if somebody gave you a vaccine to make in India, then obviously you have to do your part, otherwise it doesn't work.
The international community continues to extend a helping hand by sending medical aid to India in its fight against COVID-19. A consignment of 81,000 vials of remdesivir from the United States arrived in Mumbai early today. While Australia dispatched a consignment of ventilators and oxygen concentrators to New Delhi. As a part of the ongoing national effort to fight the COVID-19 pandemic, the Indian Navy has launched Operation Samudra Setu 2 to bring in by sea as much oxygen and associated medical supplies from friendly countries as possible. As many as 9 warships, in fact, have been diverted to various ports in the region, extending from Kuwait in the west to Singapore in the east. And shortly after noon today, INS Talwar, with 50 tons of oxygen lifted from Manama in Bahrain, would dock at a port in New Mangalore. Also, additionally, INS Airawat from Singapore and INS Kolkata from Kuwait are heading back home with liquid oxygen, oxygen-filled cylinders, cryogenic tanks, and other medical equipment. And INS Airawat is on its way from Singapore, as we said, to India with COVID relief assistance that include 6,500 and, 3,650 oxygen cylinders, 3,650 oxygen cylinders, 8 ISO tanks, and much more materials. The High Commission of India in Singapore is working round the clock for seamless coordination between all agencies, including the Indian community, for mobilizing the relief assistance. So Abhishek Jha now joins us with more on these stories. Abhishek, so aid continues to come in, and India is receiving the aid. That's not something that is unusual at a time like this in a pandemic. But the important thing is that all this aid has, been targeted in a sense, and it has been it's being sent to the places which really need it.
Of course, Mark, and we have seen that every country, like where India has been friend or India has been alive, like today we have seen that Australia government also sending a consignment to the Qantas, Qantas Airways, one of the charter flights is taking some ICU, equipment and other necessary equipments also to India, and Israel has also said it. So, of course, every country in the world which has the capacity and ability to help India at this point of time is trying to reach out and extend a helping hand. And of course, this is like the External Affairs Minister has said, it's a global fight, and it's not over until there is a even smallest portion of the world geography is infected, and we have to create all the resources so that the place where the infection is worse, like currently India is dealing under the a heavy pressure of this pandemic. So maybe India needs all the might from the world to ease the pain and the burden of COVID in India. But maybe yesterday some other country was infected, and tomorrow some other country or some other geographies maybe it's affected. So it's a collaborative war, and world has to come together to fight this pandemic both short-term way, like pooling resources in terms of therapeutic and mechanical support and all those ICU equipment that are being sent across to India, and also in a long-term struggle where we need to create a vaccine and produce enough vaccine and ensure that it is affordable and sustainable and accessible to all across the globe, irrespective of a country or people can afford it or not.
Right, thanks very much, Abhishek, for all those inputs. Moving then on to our developing story. The Union Cabinet, chaired by Prime Minister Narendra Modi, has approved the allocation of additional food grain to NFSA beneficiaries under the Pradhan Mantri Garib Kalyan Anna Yojana Phase 3 for another period of 2 months, May and June 2021. The Cabinet gave its ex post facto approval to the allocation of additional food grain at 5 kg per person per month, free of cost. Additional food grain for about 79.88 crore beneficiaries. The beneficiaries covered under the National Food Security Act, including those covered under the DBT. State and union territory-wise allocation in terms of wheat, rice shall be decided by the Department of Food and Public Distribution. DFPD may decide on the extension of lifting and distribution period as per operational requirements. Total outgo in terms of food grains is approximately 80 LMT. And also additional food grain would entail an estimated food subsidy of nearly 25,333 crore rupees. The estimated economic cost is 36,789 rupees per metric ton for rice and 25,731 rupees per metric ton for wheat. And Madhya Pradesh Chief Minister Shivraj Singh Chauhan has said that vaccination for citizens above 18 years is beginning today in the state. The Chief Minister said that Madhya Pradesh needs 5 crore and 16 lakh doses, and he added that 9 lakh vaccine doses will be administered by the end of this month.
पूरी तरह से आश्वस्त हैं कि वैक्सीनेशन अगर हमने करा लिया तो इस संकट से बचने का एक प्रभावी हथियार हमारे पास हो गया। और इसलिए आज से हमने हमारे युवा बेटे बेटियों का 18 साल से ज्यादा जिनकी उम्र है 18 से 44 उनके वैक्सीनेशन का अभियान प्रारंभ हुआ है। इस महीने हम 9 लाख लोगों को वैक्सीन लगाएंगे, जितना कम, क्योंकि मैं लगातार कंपनियों के संपर्क में हूं और हम लोग कोशिश कर रहे हैं कि जल्दी से जल्दी हमको ज्यादा से ज्यादा वैक्सीन मिल जाए तो हम तेजी से अपने बच्चों को वैक्सीन लगा पाए। तो 1.5 लाख डोजेस तो हम लगा देंगे 15 मई तक और बाकी 9 लाख तक हम पहुंच जाएंगे 15 से लेकर 30 मई के बीच में।
And now moving on to our National Prime segment. And after emerging victorious in the West Bengal Assembly elections on May 2, the TMC chief Mamta Banerjee became the chief minister of the state for her 3rd consecutive term. Trinamool Congress, the chief minister Mamta Banerjee took oath as the chief minister of West Bengal today. The governor administered the oath of office in secrecy to Mamta Banerjee. Meanwhile, Prime Minister Narendra Modi has extended his greetings to Mamta Banerjee, who was sworn in today as the Chief Minister for a 3rd time consecutively. The Prime Minister tweeted, and I quote, "Congratulations to Mamta Didi on taking oath as West Bengal's Chief Minister, Mamta Banerjee." The Bharatiya Janata Party is carrying out a nationwide dharna against the widespread violence in West Bengal as part of the protests against the TMC-sponsored post-poll violence at the BJP office in Kolkata in West Bengal. The BJP President J.P. Nadda administered the pledge to the BJP MLAs to fight against injustice and to remove political violence from Bengal. Nadda said that the BJP will protect the constitutional values laid down by Dr. B.R. Ambedkar against the political violence going on in West Bengal.
जैसे जैसे नतीजे आए हैं वैसे वैसे यहां पर एक तरीके से राजनीतिक हिंसा का तांडव हमको देखने को मिला है। मैं गया हूं उन घरों में जहां हमारे कार्यकर्ताओं पर अटैक हुआ है। मैं मिला हूं उन लोगों से, उन परिवारों से जो हमारे कार्यकर्ता शहीद हुए हैं।